So female athletes tear their anterior cruciate ligaments, the ACL, at an alarmingly higher rate in certain sports, including basketball, handball, football, soccer. The participation in sports by girls has increased dramatically in recent times. The rapidly increasing number of females participating impacts the number of injuries. However, the rates of ACL injuries in comparable sports of basketball, football, stroke soccer have remained alarmingly high with changes in male to female ratios over the last 10 years. The incidence of females to males is 3.5 times greater in basketball and about 2.8 times greater in football, soccer. The typical mechanism of injury is a rapid but awkward stop and anticipation of lateral movements. The ACL tears in about 70 milliseconds. Dynamic movement patterns are very important factors contributing to ACL injury. The extrinsic or changeable factors are controlled by the player and coaches. The intrinsic differences between male and female athletes that would explain why women tear the ACL 2 to 8 times more frequently than men. And I'm going to be explaining a few of those intrinsic factors now. The differences in reproductive hormone profiles between men and women have been identified as a risk factor for non-contact ACL injuries. Now, sex hormones have an effect on numerous end organs as evidenced by changes during a menstrual cycle and the menopause. Estrogen, progesterone, relaxin, and other sex hormones have a cyclic effect. There is no consensus of the scientific community that sex hormones play a role in the increased incidence of ACL injury in female athletes. Despite many studies on variations of anterior knee laxity and the rate of non-contact ACL injuries amongst normal menstruating participants and individuals taking the contraceptive pill, the inconsistency of literature makes it difficult to evaluate the effects of internal or external ovarian hormones on anterior knee laxity and the occurrence of non-contact ACL injuries. Now, the lower extremity static alignment and measurements have not been predictive of ACL injuries. Authors frequently state that females have a wider pelvis than males. However, females have a narrower pelvis. Now, Horton and Hall in 1989 found that males had a greater hip width by 3 centimeters and a longer femoral length by 5 centimeters. The ACL size and orientation determine width and shape of the femoral notch. Regardless of gender, smaller notches have been associated with an increased rate of ACL injuries. Now, most authors report that a smaller ligament is housed in a smaller notch. But Anderson and al. In 2001 used MRI imaging, and they noted that notch width index between the genders were not significant. With adjustments for body weight, the size of the ACL in females or girls was found to be statistically smaller than in boys. The question remains whether or not a smaller ligament is more apt to fail. It remains unknown whether a bigger ligament is stronger. Now, gender differences in neuromuscular activation patterns have been reported to contribute to ACL injury. Compared to males, females have been found to be less effective in stiffening their knee. Maximal contraction of the muscles around the knee significantly decreased the anterior tibial translation in men and women, comparing relaxed to contracted states. The female athlete takes significantly longer to generate maximal hamstring torque during isokinetic testing than males. So the muscle recruitment order in some female athletes was markedly different, and the quads was recruited initially in response to anterior tibial translation instead of the hamstrings for the initial knee stabilization. On the biomechanical side, women typically land more on the soles of their feet than the balls of their feet, which means their knees end up absorbing more of the shock instead of their calf muscles. Women also tend to run in a more upright position than men, which gives them less control over how their knee rotates. In addition, women typically have stronger quad muscles and hamstring muscles, so they rely on their quads more for acceleration and control. This places more stress on their knees than if their hamstrings were longer. Overall, the combination of biomechanical, hormonal, anatomical, and kind of training related factors as well contribute to the higher incidence of ACL injuries in females compared to males. Now, efforts to address these factors through injury prevention programs tailored to the specific needs of female athletes can help reduce the risk of ACL injuries in this population.